we're in the middle of a pandemic, but the recession we're going into is healthcare-led. Quarter 1 decline in GDP, half of it, actually a little bit more than half, can be attributed to healthcare. And that is presumably due to the delay of elective procedures. And you could sit here and discuss, because I think he starts to devolve into socialist perspectives as it relates to GDP and, all this kind of stuff. But the whole point of stopping the elective procedures was to reserve care for Wuhan coronavirus patients based on the early IMHE models that were looking at anywhere from 100 to 200,000 fatalities, even with the social distancing and the quarantine order. And now that those numbers have been drastically altered, the reaction to it has not. The reaction to it is a reaction that was based on the 100 to 200,000 fatality number. And the elective procedures stoppage was based on that as well. And now we see how in Houston there was a $17 million facility that has gone unused. The USNS Comfort had 1,000 beds, and I think at most they had 176 people. The Javits Center, the makeshift hospital that has been set up there, they've only seen that's been described by all New York press as being vastly underused. So the run on systems actually wasn't as we were told. It wasn't as those early numbers were suggesting. Now, obviously, in places like New York and in certain parts of Manhattan, you're going to see more because you have, and I know this is difficult for some to grasp, greater population density. And so when you have a greater population density, and there's also the discussion about using subways, etc., even though everyone was screaming about people social distancing on beaches, there was nothing to be said of the subways that were still operating at regular capacity. So we're in a pandemic at a time when we really, healthcare shouldn't be a problem, but yet that's the thing that is really driving now this. It's a healthcare-led recession. I mean, you're talking about losing GDP because of the missing revenue driver due to the seizure of commercial activity. That's so weird to me. It is weird. It doesn't make sense. I mean, we all know and we understand why, but pandemic and healthcare is collapsing because they're not getting enough business. That doesn't make sense, right? Kane and I are over here going, this is crazy. This is one of the things I was looking at last night. So I was looking state by state by state and looking at just the different hospitals and which of the medical staff has received pay cuts, furloughs, laid off, etc. It's pretty serious. I mean, we're talking about the disruption, a potential disruption of food supply as it relates to meat packing, but we also need to talk about the potential disruption of medical care because of the way that this has been handled, right?